Dear colleague, the case that I present today is a fetus with multiple malformations. This is a pregnant woman who comes to our attention for the first time under the age of 35 years, the second pregnancy, and performs an examination of the karyotype is normal. We begin the study with this image of the abdominal cetus, not observing the correct location of the abdominal organs. We have seen how the aorta and inferior vena cava were regularly disposed and watched a small stomach and bowel smooth. This formation anechoic, which is in the right portion of the abdomen and part of the chest, could be attributed to the gallbladder. We stopped the image of the cetus to determine that it was the cetus solitus. Given that this formation anechoic, positioned in the right portion of the fetus, was precisely the gallbladder, much of the gallbladder was left along with the liver in the chest. In the chest, this determined a shunt to the left of the mediastinum, and in fact, with the help of a color, we have seen as the heart, while being in levocardia. It's all positioned on the left. Still displays the abdomen and observe the umbilical vein entering the abdomen. The images with the color will show a regular course of the umbilical vein. Established the cetus, we call this formation in the left portion of the abdomen as the stomach. The gallbladder is left all in the right portion. So with the stomach to the left and the heart placed in levocardia, we call established a regular cetus. This marked disposition to the left of the heart was then due to right diaphragmatic hernia, which had claimed most of the liver and the gallbladder. It was therefore a diaphragmatic hernia. We have executed immediately the study of the fetal heart, which showed the regular anatomy, with the regular left section, with the regular section on the right. Thus, the cardiac anatomy was smooth, and we know that in case of diaphragmatic hernia may be present heart defects. Having karyotype examination found to be regular, we have begun to hypothesize syndromes that can be characterized by diaphragmatic hernia. The fetal anatomy appeared regularly across, but in this picture there was hypoplasia of the chin. You could see a regular tongue, regular frontal bone, nasal bone adjust. When we observe a diaphragmatic hernia, should always suspect of syndromes, and there are several syndromes that are associated with diaphragmatic hernia. Primarily trisomies, but having performed the karyotype found to be regular, we excluded this possibility in this image with the help of a 3D. Confirmed the suspected diagnosis of a micrognathia. Another sign that it was clear was the anomaly of the upper portion acromegaly left hand, which showed a oligodactyly. In fact, in this image is displayed only 4 fingers. It appeared difficult to determine whether missing the second, or the fourth finger most likely, considering the distance between the third and fifth finger, missing the fourth finger. So, the combination of these three signs made us suspect that this was a fatal framework syndrome. In these cases, the anomaly of the extremities, in case of diaphragmatic hernia, can be restored to Fryns syndromes or syndrome de Lange Cornelia. Having performed the karyotype found to be regular, it was necessary to perform genetic counseling and counseling with the pediatric surgeon to determine the timing of delivery. Obviously, the geneticists should perform all investigation possible to give a definitive diagnosis. Thank you for your attention.